gave this presentation maybe like 7 or 8 years ago at my previous job. And since then, though, there's been quite a bit of new information that sort of has come out. So I thought it would be, a good thing just to sort of review kind of the newer stuff that's come out, and then to sort of get your all's opinion on sort of, if your view on this is changing, because I think it's something important for us as surgeons to understand, what you all are recommending as far as this goes. So just to start off, kind of, how did we get to where we are now? Really, most of it was a result of urbanization and overpopulation. So in the 1930s, though, we started performing these procedures because of the inconveniency of heat cycles in the urban environment. So people didn't like that they were having these, heat cycles in their houses. So that's when, one of the reasons for it starting to become common. Then in the 1950s, it became more of a problem for a way to address the overpopulation of pets in New York City. Then in the 1960s, humane groups started requiring pets to be, initially asking owners to have them neutered prior to adoption or signing some sort of contract, but they were finding that people weren't really compliant with those contracts, so sort of shifted towards, having those pets altered prior to adoption. And then in kind of along those lines, in 1975, the Maryland ASPCA started recommending early neuter to try to get as many pets as possible neutered before being adopted. And then in 1993, the AVMA started supporting this as well. So that sort of early age, the 8 to 16 weeks of age, prior to being adopted, again, mostly just to try to, decrease overpopulation. So as a result of that, we're kind of what we think of as common practice now, where we're recommending these pets be neutered between 6 and 9 months of age, but in the shelter situation, it's 8 to 16 weeks. And obviously in females, the recommendation is to get them altered prior to their first heat cycle. This sort of practice that we have in the US is kind of in contrast to many European countries where neutering is actually quite uncommon. And I think it's Norway, it's actually illegal to neuter a pet unless there's some sort of medical reason for it. So, with this sort of discrepancy and sort of, the way that we got to this with just sort of being, urbanization and overpopulation, now the question has sort of become, what are the clinical effects of, removing these hormones in these pets? And then also, how early is too early, or, what are the effects, when they're much younger? So, just to, the basics of, okay, what are the benefits of neutering? In the females, certainly preventing mammary tumors is a, top reason that we usually think of. And there's that classic paper that we all learn about with, about 0.5% developing tumors if they're spayed prior to their first heat, 8% after 1 heat cycle, and 20% after 2+ heat cycles. Along those same lines, by removing these hormones, you decrease or eliminate the sort of development of these reproductive tract tumors, so ovarian, uterine, that sort of thing. And then you also remove the risk of pyometra, where about 23% of intact females develop it by 10 years of age. And so if you've removed the uterus, they're not going to run into that as a problem. Spaying also obviously eliminates the annoyance of estrus bleeding in the house, and also sort of eliminates the unwanted pregnancies, because a large portion of pets that are surrendered to shelter situations are from these unwanted pregnancies. So if you spay them, obviously we're gonna decrease that number. And then there's also some evidence that says that these pets live longer with removing those hormones. As far as the males go, kind of similar sort of type thing, where, when you castrate them, you remove the risk of testicular cancer, which has about a 7% incidence in intact males. And it's particularly important to remove those in the cryptorchid pets because they obviously have a much higher risk of developing those tumors. By castrating them, you also, remove the risk of prostate hyperplasia, which is very common in older intact males, which can obviously cause some issues. You remove the risk of, or significantly decrease the risk of perineal tumors, perineal hernias, And then in males, there's some evidence that, like by removing those hormones, you decrease some unwanted behaviors like mounting, aggression towards other dogs, roaming, and then urine marking in the house. Similarly, there's longer lifespan in these males, and that may be due to the fact that they aren't roaming and out there and getting hit by cars and stuff. So those are kind of the main benefits that we sort of think about with neutering. So as far as what has been reported as far as risks, in removing these hormones, what are we sort of, what risks are we putting these pets at? So obviously it's a surgery, and so there is going to be some, risk with that, with about a 6% risk overall. But mainly that's sort of incisional infections, chewing at the incision, that sort of stuff. So most of them are minor, but it still is a surgery, and there still are those risks. With females, neutering has been known to, significantly increase their risk of incontinence, with, almost less than 1% having intact females developing incontinence, where with, spayed females, it's anywhere from 4 to 20% in those guys. And that risk of developing incontinence is certainly higher in those pets that are spayed at less than 3 months of age. With spaying, you also, particularly in the early stage, you also sort of can lead to immature genitalia, so like a recessed vulva, which then can sort of lead to, increased risk of maybe UTIs, as well as perivulvar dermatitis and those sorts of issues. In males and females, it's also been reported that neutering does increase the risk for development of hypothyroidism. Also, vaccine reactions have been reportedly increased risk in both males and females that have been spayed. And behavior, unlike in the males, there is some reports that in the females, there are some negative side effects to having them spayed. And there's an increase in reactivity towards humans with unfamiliar dogs. And it's also been sort of shown that there's more aggression towards family members. And then in the males, there may be a little bit more of a faster progression of cognitive impairment in neutered pets. And then obesity is certainly something that has been shown to have an increased risk of developing that in males and females, when they've been neutered. So those are kind of like the medical type things that have been reported. And then the other sort of main focus has been on various cancers. And with osteosarcoma, there's been reported of almost double risk of developing that in a neutered pet. And then with Rottweilers, there's sort of that kind of classic study where they found that Rottweilers that were neutered prior to 1 year of age, those females had almost like 3 times risk of developing osteosarcoma, and the males had almost 4 times that risk of developing it. For splenic hemangiosarcoma, it's been reported that females have about double the risk of developing that when they've been altered. For cardiac hemangiosarcoma, about 5 times risk in the females, and a little 1.5 times risk in the males. Mast cell tumors have also been shown to have an increased risk with spayed females, and lymphoma as well, about a 30% increased risk of developing that in the spayed females. Lower urinary tract neoplasia, so like transitional cell carcinoma, that's sort of a 2 to 4 times the risk in these pets that have been neutered. And for males who have been neutered, there's about a 4 times the risk of development of prostate cancers. So that's kind of the neoplastic type things that sort of have been sort of sporadically reported through the literature. And then there's orthopedic considerations. And so these pets that have been neutered young, there's one study that looks at, a group that was at 7 weeks, 7 months, and then compared it to the intact. And what they found there is that those dogs at 7 weeks kind of grew taller, and at 7 months, they didn't necessarily grow taller, but their growth plates were delayed in closing. And so the thought there is that by sort of altering that bone growth, that their conformation is going to be different, and then it's going to predispose them to some of these other orthopedic conditions. such as excessive tibial plateau angle. And so there was a paper that looked at, the excessive angle of the plateau and found that there was like 3 times the risk of developing a steep angle or too steep of an angle if they were altered less than 6 months of age. And when they were neutered young, they also had a very high risk of developing it in both knees. And then the thought is that when they have a high tibial plateau angle, they're going to end up, significantly increasing the risk of developing cranial cruciate ligament disease. Kind of independent of that study, there's other studies that do suggest that, being altered is an increase or is a factor that increases their risk of developing cranial cruciate ligament disease. And then hip dysplasia as well. There's, papers that say that there's a 70% increased risk when these pets are neutered, young or less than 6 months of age. The interesting thing about those, the older papers is that basically they found that while the risk or the development of it was increased, these pets had a less sort of severe form. So they weren't basically being euthanized any earlier for the disease than sort of the similar pet without the disease. Why that happens, they're just thinking, obviously there's some hormonal influence on it. So those are kind of, the 3 kind of main groups as far as some medical things, neoplastic stuff, and then orthopedic diseases that sort of have been reported to have an increased risk with, altering these pets. But it's kind of, these are all sort of somewhat smaller studies. A lot of them are like database reviews that then sort of come to these conclusions. So it doesn't really kind of, help us too much as far as making a decision goes, because we really have to sort of look at, okay, what is the, frequency of these diseases? Some of these cancers might not be very common. Some of these problems might be not very common. So even though it's an increased risk, is it really something we need to do anything about or change our plan based on? And then so it's obviously also important to think of the severity of the disease, the availability of treatments, how effective these treatments are for these things that they may be more predisposed to, and then to sort of think about, okay, are there differences in breed predispositions? And so kind of all that initial stuff that I kind of talked about, there is a really good sort of review paper that kind of puts together all of these references. That's the one that I've sort of listed there. And then what they then did after kind of reviewing all of this is they basically looked at some of the very common, basically all these things that I sort of was just talking about. And they sort of figured out, okay, this is the incidence of all of these, diseases. And then they assigned each one of these diseases a morbidity score, kind of depending on how much that, disease, what the treatments are, how much it affects their quality of life, prognosis, all that sort of stuff. And then with that kind of score, they then came up with multiplying those 2 together, they came up with an impact score. And so for each of these problems, a positive score sort of suggested that, removing those hormones was beneficial, where a negative score suggested that by removing those hormones, it was a negative effect. And so then they kind of put all this stuff together. And so the conclusions after that stuff was basically that in females, the benefit of spaying outweighed the detriments. And so they still recommended, having these pets spayed at that sort of 6-month age mark. Where in the males, the benefits of castration did not outweigh those detriments. So they had a lot more negative impact scores. And so their recommendation would be to sort of let them become full grown before, performing that procedure. So that's kind of, summarizing everything. And then the other sort of set of information out there is all these studies from UC Davis. And so I'll go through this whole series of studies, but they were basically looking at, certain breeds and trying to look at, the effects of neutering at these various stages in life. So the first study was 2013. They had about, 750 golden retrievers aged 1 to 8 years of age, and they divided them into 3 groups: the intact, early neuter, and late neuter. And they looked at these kind of important diseases that we see: hip dysplasia, cruciate rupture, lymphoma, hemangiosarcoma, mast cell tumors, and mammary tumors. And in that study, basically with hip dysplasia, they found that with early castration, there was an increased risk of developing that disorder in males as compared to the intact males. For cruciate disease, they also found that there was an increased risk in the golden retriever of developing cruciate rupture in the, those females that were spayed early as well as the males that were spayed early. And for lymphoma, they found that with early castration, the males also had an increased risk of developing that disorder. For hemangiosarcoma and mast cell tumor, it's a little bit different in that basically they found that when they were spayed early, they were about the same as a pet that was left intact, where when they were spayed late, again, in the golden retriever, there was an increased risk of developing hemangiosarcoma and mast cell tumors. To look at this a little bit more graphically, they have these sort of charts in there that sort of looked at, again, sort of all these main problems. And for the black is sort of the intact pet, the gray is the early neuter, and the light gray is the early neuter, and the dark gray is the late neuter. And so for the females, they found that when, again, sort of early spay had an increased risk of developing cruciate disease. There was also an increased prevalence of lymphosarcoma, but it was not significant. And then for the late spay, again, sort of increased risk of hemangiosarcoma and mast cell tumor. And for the males, it was mostly the orthopedic diseases, so increased risk of hip dysplasia and cruciate disease in that early castration, and then also lymphoma. So that was kind of the first study that was sort of, put out. And really from this, they didn't make any real recommendations. We're just sort of reporting, again, that these were some of the things that they found. So their next kind of step was to look at, the common labs and, golden retrievers and Labradors. And so 2014, they did this study and had, a bit more, larger number of Goldens and then about 1,500 Labradors. They divided the groups up a little bit more, so less than 6 months of age, kind of 6 to 12 months or 11 months of age, between a year and then 2 to 8 years compared to the intact. They looked at the same disorders, but then they added in elbow dysplasia as well. For results of this, the golden retriever is sort of basically the same findings they found in the 2013 study. For the labs, they found that females that were spayed kind of less than 2 years of age did have an increased risk of developing hip dysplasia as compared to the intact. And then for cruciate disease in the males, there was an increased risk of developing that for in the early castration group. And elbow dysplasia, same thing, the males had an increased risk of developing that. So then they sort of, looked at all these sort of problems, but then they sort of decided to kind of group it into, okay, joint diseases and neoplasia. So basically they said, okay, what is the risk of developing one of these joint diseases that they evaluated in, relate that to their when they were neutered. So in the golden retriever, they basically found that in females that were spayed less than 6 months of age, they had a 4 times increased risk of developing one or more of these joint diseases, and the males, that risk was 5 times. And then in the Labrador, for both males and females, their risk of developing a joint disease was double that of the pets that were altered or left intact, greater than 6 months of age. For cancer, neoplasia here in the lab, they really didn't find any effect of the neuter status and development of these cancers. But in the golden retriever, they found that any type of spaying at any point in time actually did increase the risk of developing one of these cancers, by 3 to 4 times. So that was kind of the next big study sort of that they did. Then they sort of just a little bit of an offshoot of that. They did a study in German Shepherds, obviously another common, breed that we see. Same study design. The things that they just added in this time were they also looked at osteosarcoma and urinary incontinence and pyometra. And for this breed, they basically found that for the dogs that were less than 8 years of age, So basically, all of these disorders were followed only up to 8 years of age, other than the mammary tumors, which they followed to 11 years of age. And so at less than 8 years of age, basically all the cancers that they looked at had really, there was no influence on their neuter status and development of these cancers. But with mammary tumors, since they looked at it further out, the intact pets did have a 4% incidence of developing mammary tumors, which was obviously higher than those pets that were spayed early. And with urinary incontinence, kind of the opposite, where the intact didn't sort of develop that at all, where the early spay did sort of have about a 7% chance of doing that. So not huge things as far as the cancer goes for, in the German Shepherds. But they did find that there was a significant influence of these hormones on the development of joint disorders in German Shepherds. And so basically males that were sort of neutered young, so less than 1 year of age, had about a 21% chance of developing an orthopedic disease, and females had about a 16% chance of developing that, as compared to the intact, which were 7% and 5%. The most common disorder that they found in this breed was cruciate disease. And they did also sort of, because obesity, can be influenced by neuter status, they kind of made sure that body condition score wasn't sort of, altering this finding, but they found that it was sort of same between these groups. So that's kind of the German Shepherd study. And then, after sort of these 3 studies, they sort of put together, I guess, a somewhat more useful one. They basically did the same study as everything the same from the German Shepherd group, and they looked at 35 different breeds for all of those disorders. And they did, some of it's a little bit statistical, but they basically, came up with recommendations for all of these 35 breeds as far as, based on the risk of developing these cancers and these joint diseases, when would be the best time to neuter them. And on this sort of list here, the pink means that there's recommendations for the females. The blue means there's recommendations for the males. The yellow means that there's recommendations for both males and females. And the white basically means that they didn't, have any recommendations. The additional thing that they did look at here was the corgi and the dachshund, and they looked at their risk of developing disc disease. Basically in the dachshund, it didn't matter if they were neutered or not, they just had a very high risk of developing that. But in the corgi, there was an increased risk in the males for developing disc disease when they were neutered young. So this chart here is what they have in there, and that's sort of a little bit more easier sort of way to kind of look up a breed and kind of figure out, what their recommendation is. Whether it's sort of up to you because they didn't find any influence, or whether they, recommend at 6 months, a year, or beyond 2 years. Some of the big findings or generalized findings from this is just for the joint disorders, they didn't find any increased risk in small dogs. That would seem to be independent of their neuter status. For cancer, the only small breeds that sort of seem to have their neuter status played a factor was the Boston Terrier and the Shih Tzu. And then kind of the 3 breeds that we just sort of went through their studies, basically with they then sort of finally made some recommendations on when they would say these pets should be neutered. And for the Goldens, for the males, it was beyond 11 months. For the females, they actually recommended that they be left intact. For the Labradors, the males were beyond 6 months of age, and the females were beyond a year of age. And for the German Shepherds, both male and female, they recommended waiting for them to be full grown at about 2 years of age, again, mainly because of those sort of joint diseases. So that was their kind of breed specific study. And obviously this is not exhaustive, but at least it looks at a lot of common breeds. And, there is a reference here to sort of look at, to sort of see, is there something we should be considering, kind of, changing our opinion on. The final study that they did was with mixed breeds. And so they looked at mixed breeds, and then they were just trying to figure out whether they could, make any recommendations just in those mixed breeds based on weight. And they had 5 different groups: small, medium, standard, large, and giant. And same kind of thing. They make this chart with sort of, what do we recommend? And in the small and medium breed dogs, they just, they didn't find any significant influence to sort of make a recommendation on when these pets should be altered. But with the standard, large, and giant dogs, they had a significant increased risk of joint disorders. So, they recommended that they wait till at least 11 months, if not, further beyond that, particularly in the giant breed dogs. In this, and really, like I said, these recommendations are really just based on their risk for development of joint disorders. With the cancers, they really didn't find, any influence on that. And so the thought maybe there is that, it's more of the development of those cancers is more of a breed predisposition versus, just the size of the dog at the time that they are neutered. So kind of putting that sort of all together, it's a lot of stuff to sort of sort through. It is a lot of, these studies are not perfect by any means. The one with the 35 different breeds, there was various sort of numbers of dogs in there. So it's not perfect by any means, but I think that, having this information out there now, I think that, it is, our responsibility to basically, educate the owners on sort of the risks and benefits of having these procedures performed. And then to sort of discuss some of this data that is out there, particularly the golden retriever that is out there that says, that they may be predisposing, maybe predisposed to some of these cancers and such. I think that there is sort of, with all the joint diseases, there is some evidence to say that, neutering can, in the large breed dogs, certainly, delaying that. I think that there is a, way to sort of make that there's enough information to say, make that recommendation now. And I think, though, that if we are sort of delaying these procedures, that it's important for us to, inform the owners like what to look for some of these diseases that they may develop, like the mammary tumors, like pyometra, so that if those things are found, obviously they can be addressed, but just so that owners are more proactive in sort of getting treatment for these things versus not being aware that the pet could get a pyometra. And then the kind of the final thing is just that, despite all this new information out there, I certainly don't think it changes, the recommendations for shelter medicine, because we're still just trying to, work on population control there and decreasing the burden on these shelters. So I certainly don't think it's something that's going to change the way that, we look at shelter medicine, but certainly something just to consider for, pets that are owned and, have responsible owners, basically. So hopefully that wasn't too fast for everyone. But I just wanted to see now, like, if anyone is making any different recommendations, with these sort of studies that are out there, or whether, everyone's still just kind of at that sort of, 6 months and, sticking with that, basically. I don't know, can people talk? I'm not sure. Yeah.
You guys can type something into the chat, or if you don't all go at the same time, you can go one at a time and say something out loud. But that was, there's a lot of stuff to take in. So let it soak in for a second and then respond.
Based on these studies, I've generally been recommending large breed males to wait until they're a year and a half. Just based on, I tell them we don't have concrete evidence, but there's pretty good evidence and there's little risk unless they're showing behavior issues.
Right. Yeah. And that was sort of like when I gave this presentation, like whatever, 8 years ago or whatever, that was sort of, the conclusion that I came to. And it seems to be the thing that sort of has the most confident thing that sort of has stuck with these newer things that are out there.
Did the impact study have a breed associated with it, or was that just kind of summarizing the other studies?
Yeah, so they were basically taking all those other studies that were out there and then just kind of coming up. They didn't really explain sort of how they came, exact morbidity score thing, like where those numbers came from, but no, they just looked at all the studies together.
Thank you.
Mm-hmm. I have a question that came in. What about OSS? Where do you stand on that?
OSS.
OSS. Know what that is?
All right. I'll wait for that person to give me more information then. Let's go on to Dr. Urbanate. Most neuters are closer to a year, she says. Spays still 6 months, or when the adult dentition fully in for small breeds to catch deciduous teeth. So that was her take on that.
Nice.
Sabrina Walters, we've been recommending spay neuter for dogs over 50 pounds as adults be neutered at 12 to 18 months, unless there's some extenuating circumstance, advocating at least 6 months of age. That's from Sabrina. From Robin Delbove, we do evaluate each situation, but are tending to neuter later. So there was some change happening there at her practice. Okay, so OSS, ovary sparing spay. What do you think about that?
Right. I guess I haven't actually thought about it that much, I suppose. The problem, I guess, there is that, I mean, the thought, I guess, is that the ovaries are still there. So I guess you could still develop those. So you're basically just decreasing the risk of pyometra. I'm not sure, I guess I'm not familiar enough to know whether that is something that it influences. I can see how it influences pyometra, but whether it influences mammary tumors, probably not. So I guess the only thing is that, like, you know, if in a lot of these pets, we are still eventually spaying them so that we decrease that risk of those tumors and those, you know, pyometra, that in doing that, you're still putting them through a procedure that may not completely eliminate things. So I don't know. It's something that I haven't really, unfortunately, thought too much about, but I certainly will now.
Aubrey says, shelter vet here. So I don't really follow these studies, and that was your conclusion too. Nothing changed. But the vast majority of the S spays neuters we do are on, this is pitfall type dogs. Pit bull, that was my guess. Is there any research about how earlier castrations affect the bully breeds?
Yeah, so that's like one of the breed. I think that, let's see, I don't even remember. Let's see here, whether that was, I think they were in this, hold on. Let's see. Yeah, I guess actually they were not in that study, which is actually surprising considering how prevalent they are. I guess maybe in California, they're not as prevalent, which is where they came out of. But no, I did not come across any specific sort of studies with that breed. The only other weird breed that I kind of came across was a Bisla. There's a paper on that, but pit bulls, yeah, I did not find anything on that.
Marlene has a question for you. She asks, any insight as to why Nordic and European countries don't have population issues with their high rate of intact dogs?
So what I came across with that is basically they have very strict laws and very high fines with that they do actually enforce. And so people are much better at controlling the behavior and breeding of those pets. So they just have a lot more control of it because they make people feel bad and they make people pay when they sort of, you know, don't follow those rules, which we can't get people to do in the US. So
different culture, I guess.
Yeah, exactly.
When Veterinarian had this comment, she says, we are educating clients and letting them decide. We're now spaying quite a few adult dogs, which is not as enjoyable as spaying puppies.
Yeah.
It's like her comment.
Yeah, that is the harder thing. I mean, so one of those sort of, you know, pros cons is that obviously with the early spay, there is less to put them through because it's a smaller incision, it's more pliable tissues, they recover a bit more quickly. So that is, you know, a factor in that, like when you're doing the spay in the large or the full grown dog, it obviously is a little bit of a bigger procedure to put them through.
Jen has a comment. She says, as someone who competes in dog sports, there's been a big step in the direction of keeping your dogs intact. This has seemed to reduce the number of CCL tears and orthopedic injuries.
Yeah, I definitely think, like with, how commonly we see this cruciate disease, that there has to be something, and this seems like a good sort of thing that influences it, because it just seems so much more common than it used to be. So.
Interesting. Yeah.
Mm-hmm.
All right. What else do you guys think? Oh, here we go. Dr. Johnson. Easel does spays and neuters of puppies and kittens when they're over 2 pounds body weight.
Mm-hmm. Mm-hmm.
So there's that. That's how they do it.
Yeah, and that's like the common, like for the shelter type situation. That's what I think they usually recommend.
All right. Well, give everyone another minute to type something in if they have a burning question. This is your chance. But Dr. Johnson, in the meantime, I want to thank you for bringing this research to light. Maybe it's something that they kind of feel and sense, but to have a nice study to kind of confirm things is kind of nice. So thank you for bringing that to the table for us. All right, cool. All right, I'll keep an eye on the chat, but I'm going to start wrapping it up.
Yeah. Yep.
So thank you again to our sponsors for helping us put this together. Whoop-ah, hold on, here it comes. Are there any studies in cats?
Yeah, so I mean, there are, yes, there are another sort of set of studies in cats, but obviously I didn't sort of review all of those because I just sort of focused on the dog here. But yes, there are studies in cats, but I believe sort of the conclusion from that is still that, you do it sort of at that young age, but I'm not 100% sure. But yes, there are a few studies on cats, nothing like we have for the dog here.
And I'll ask, what was the recommended age to spay golden retrievers?
Never.
So actually for the golden retriever, the kind of final conclusion that they made for females is to just leave them intact because of the risk of developing those common cancers. And that's provided the owners can deal with the heat cycles is the problem. And so I guess in those cases, you're just spaying them if they end up developing pyometra. So the owners have to be aware and be watching for that.
Yeah. Okay. Okay. From Bartholomew, not necessarily related to timing, but now that we are doing larger dog spays, do you have any recommendations for additional pain control other than pre-meds and NSAIDs, other than Nocita, which can be cost prohibitive?
Right. Yeah, that's the thing. It's like Nocita is probably the best thing that we've sort of been adding, which has been very helpful, but obviously it's quite expensive. And whether they truly need it that long, for 3+ days afterwards, they might not, so you could do other just like, bupivacaine type blocking and such along the incision. We oftentimes will use gabapentin or pregabalin as well. Just kind of helps them keep them sedate a little bit, as well as maybe provide some pain control. Other than that, yeah, it's just sort of anti-inflammatories and, the pre and maybe giving them a post-op dose of Bupronex or something like that.
Do you find an increase in incisional infections with line blocks?
I have not so much at NorthStar, but like in the job I was at before, like we put Nocita in everything. And I really never saw like anything that I felt like that was increasing the risk of developing an infection. So personally, I've not had that experience of it causing that kind of problem.
Okay, here comes some more from Dr. Dana. She says, I've been doing a lot more mature dog surgeries, many neuters having more scrotal swelling and seeing some need for scrotal ablations. That's her experience.
Yeah, which is like not too much harder to sort of do. I mean, it's a little bit of a bigger incision, obviously, but certainly in those older dogs, doing the scrotal ablation is helpful to not get that swelling afterwards.
Nice. All right. Well, Dr. Johnson, thank you. This is fantastic.